Hi everyone, I'm Divya. I'm doing MBA in Ham Business School 12th batch. I'm a member in Enviro Club. First of all, thank you for Roshni ma'am, our director of Ham Business School, and our trainer Alex sir, and our training coordinator Aisha ma'am to give this wonderful opportunity and biggest thank for our Enviro Club. I'm going to talk about infant mortality. First of all, what is infant mortality rate? Infant mortality is the death of an infant before his or her first birthday. The infant mortality rate is the number of infant death for every 1000 live births. In 2020, the infant mortality rate is 30 death per 1000 lives. It's decreased now. Yes, it's very good to hear significant decrease from previous year, right? Why it's happening? Because of mainly four causes: preterm birth, intrapartum related events, sepsis, meningitis. These are all the worldwide causes. Friends, do you know what are the major causes for infant mortality rate in developing countries? There are a number of causes of infant mortality rate, including poor sanitation, poor water quality, malnourishment of the mother and infant. And biggest things is women's health status and disparities of health are also reflected in infant mortality rates. How can we reduce the infant mortality rates? Preventing birth defects, addressing preterm birth, low birth weight, and getting pre-pregnancy and prenatal cares. Creating a safe infant sleep environment using newborn screening to detect hidden condition rights. And some of these steps are taken by government to reduce infant mortality rate. Yes, promotions of institution delivers through cash incentives under Janani Suraksha Yojana and Janani Sishu Suraksha Karyagaram. This entitles all pregnant women delivering in public health institution to absolutely free antenatal checkups, delivering including cesarean section, postnatal care, etc. Is malnutrition common cause of infant mortality? Yes, 45% of infant death are caused by lack of nutrition. Especially marasmus is a severe form of malnutrition. Specifically, proteins, energy and undernutrition also. If anyone have marasmus, they lack the fuel necessary to maintain normal body functions. Do you know the symptoms of marasmus? Dehydration, slow blood pressure, slow eat rate, low body temperature, anemia and rickets. These all are the symptoms of marasmus. How can we prevent marasmus? The average time spent in treatment for marasmus is 42 days. After treatment, those who return to a caring environment with the resources they need to maintain good health can generally expect to make a full recovery. Continuing vitamin and mineral supplementation may help. Kwashiorkor is also same like that only. Do you know? The main difference between them is that kwashiorkor is predominantly a protein deficiency, while marasmus is a deficiency of all macronutrients, protein, carbohydrates, and fats. Causes of kwashiorkor are some new conditions that interfere with protein absorption, such as cystic fibrosis, dietary change for management of milk allergies in infant and children's, diets that are low in protein, such as vegetarian diet, drought or famine, infections that interfere with protein absorption. How is kwashiorkor treated? Treatment of kwashiorkor depends upon its severity. Fluid and electrolyte imbalance may need to be corrected with intravenous fluid, and infections may require treatment with antibiotics. Although the goal is to increase protein in the diet, rapid increase in calories and proteins can be dangerous. Often the calories are slowly increased by adding carbohydrates, sugars and fats to the diet. Next, protein is gradually added. People who have malnutrition may have difficulty digesting the lactose in dairy products. So the enzyme lactose may be added. Vitamin and mineral supplements may also be used. Common treatment for kwashiorkor: antibiotics to treat infections, gradual increase in dietary calories from carbohydrates, sugars and fats, gradual increases in dietary protein, intravenous fluid to correct fluid and electrolyte imbalance, lactase to assist in digestion of dairy products, vitamins and mineral supplement to treat deficiency. What are the potential complications of kwashiorkor? In some people, especially infants and children, complications of untreated or poorly controlled kwashiorkor can be serious, even life-threatening in some cases. You can help minimize your risk of serious complication by following the treatment plan you and your healthcare. Professionally designed specifically for you. Complications of kwashiorkor may include anemia, coma, frequent infection, intellectual disability, physical disability, poorhood, healing, shock, short stature, skin pigmentation changes, and steatohepatitis, that means fatty liver. Some technical notes for infant mortality rates are: an infant mortality rate is considered a primary and important indicator of a geographic areas overall health status or quality of life. There are some concerns about the quality of reporting of infant mortality internationally and within states, especially in terms of defining a live birth and or complete reporting of both birth and death certificates for every low birth weight babies. The IMR is usually calculated using the annual number of resistant infants who died during a year in the numerator and the total annual number of resistant live births during the same year in the denominator. By matching infant death certificate to the corresponding birth certificate, much more additional and valuable data are obtained. For infant mortality risk analysis, in less densely populated areas, annual number of infant death may be small, which would be result in the infant mortality rate considered to be too unstable or unreliable for analysis. Adding additional years, 3 or 5 years average annual rates and or expanding the areas to be studied should result in large number of death and more reliable rates of analysis. See North Carolina Statistical Premier, Problems with Rates Based on Small Numbers, Pennsylvania Technical Assistant, Small Area Analysis, or Washington State Guidelines for Working with Small Numbers. The Division of Vital Statistics at NCHS follows standard for use of the term death rate and mortality rate. In naming and reporting common vital statistic rates for death, the NAPSIS standard measures shows here follow the DVS standard. Primarily to maintain consistency with DVS for naming conventions, please note that states, registration areas, and other federal government organizations within and outside NCHS CDC may not follow the DVS standard when naming and reporting death mortality rates. According to DVS standard, the following naming convention are used for the common vital statistic rates for death. Results of infant mortality rate. Overall trend in infant and child mortality is on the decline in India. Computation of relative change show the majority of the states have witnessed over 50% of reduction in both infant and under 5 mortality rates from National Family Health Survey. NFHS 1 to NFHS 4. However, the improvement are not evenly distributed and there is a huge variation in performance between states over time. Funnel plots show that the most popular states like Uttar Pradesh, Bihar, Madhya Pradesh have underperformed consistency across the survey period from 1992 to 2016. Regression analysis comparing high-performing and low-performing states revealed that female infant and women with shorter birth intervals have greater risk of infant death in poor performing states. And conclusion of infant mortality rates is attempt to reduce infant and child mortality rate in India are heading in the right direction. Even so, there is a huge variation in performance between states. Mix of strategies that reduce child and infant mortality among the high impact states where the biggest improvement can be expected, including the needs to address near national mortality. Health policy, public health, community, child health, infant mortality, developing country India, and strength and limitation of infant mortality star. The study shows trends in infant under 5 mortality rates from 1992 to 2016. Using the 3 rounds of data covering most of India, a more effective approach using funnel plots quantified the variation in performance of states with respect to child mortality rate. The study attempts to understand how factors associated with infant death act differently in underperforming and well-performing states. Limitations in analysis based on secondary data also apply to this study. As a result of grouping states, some state-specific factor affecting infant mortality may get diluted. I hope you understand about infant mortality rate and marasmus and kwashiorkor. Life is a brief intervention between birth and death. Enjoy it. But birth, life, death, you can't control the ends. Middle is all up to you. Thank you for listening. This is Divya signing off Enviro Club.